everyone. Welcome. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at JCMC, Jersey City Medical Center, division of Rutgers Health. It is my pleasure to welcome my co-host, Dr. Angel Lazo.
Thank you. My name is Dr. Angel Lazo, and I'm with RWJ Health at Exchange Place, and I do internal medicine. Today we're going to be covering our episode to include women's health, and we have a guest with us, Dr. Lance Bruck.
Dr. Lance Bruck is chair of women's health at Jersey City Medical Center. He's also clinical professor of obstetrics and gynecology at Rutgers University. We're very excited to welcome him today and really to talk about the broad spectrum of women's health care we have at Hudson, in Hudson County. The whole purpose of the show is to talk about how we're committed to take care of women from the first gynecological exam to menopause through the entire spectrum of a woman's life, whether it's acute care, preventative health, prenatal health, postnatal, the entire spectrum. It's of course, 50% of our population are women. So
absolutely. Now, again, from primary care health perspective, because I do internal medicine, we do our primary care preventive health services for women. Like, for example, when I have a female patient that's hypertensive, my choice of antibiotic is geared towards women's health, so on and so forth. But again, today we're not going to focus so much on the primary aspect. We're going to focus more on the preventive aspect of gynecological services that we actually offer.
And a common theme that we always explore in this show. We're looking forward to it.
Okay. We're going to be going on break back, and we'll be right back with our guest.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you, so get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
So welcome back to Hudson Health, and today we are going to have a special guest that we're going to be talking to in a little bit, but we're going to be talking about women's preventive health services. So let's talk a little bit about that.
Yeah, and Dr. Lazo, it's everything from throughout the lifespan of a woman. So preventative health services including screenings, mammographies, pap smears, but it's also things like that we need for prenatal care, genetic counseling, nutritional counseling, all these things. And what's interesting, for most women, women's health services is the introduction to the healthcare system and really the foundation from which to build out and maybe get a primary care doctor or introduce their families or their husbands or their significant others to the healthcare system.
And it's very important, especially for preventive services for women, because women are a little bit more involved now, not just in their family, but they're involved in their careers. Most women are actually having their first child now much older than, for example, in my generation. So these preventive services actually become even more important to be able to offer them. We have the fortune actually that even Dr. Bruck is actually in our Hoboken location to be able to serve our community. So we're going to be talking to him about what he does and some of the things he can offer actually in our community.
Correct, and we'd like to talk to him more about just the wide range of services, right? Everything from what you do when you don't like going to your annual mammogram to, what kind of services you need when you're postmenopausal and what kind of services young, healthy women need. So I'm really excited. RWJ Barnabas has really, really been committed to women's health across all the hubs. I know we've talked about primary care in the prior episode, but integrating that even into primary care has been a big focus of the health system.
Yeah. And again, focusing on the preventive measures for our patients is actually key. And again, it includes all the services that you could possibly imagine, and
right.
within the system. So in other words, they can become family members of our RWJ Barnabas Health in Jersey City, but you're all over the state with all our professionals and all our expertise and all our academic doctors and the affiliations that we have. So it's very
Absolutely.
exciting, actually, for Hudson County.
Absolutely, and God forbid you need it. You have our affiliation with the Cancer Institute of New Jersey, with all our specialists, and like you mentioned, a top-notch academic program to back it all up. And you know, I find this area of medicine fascinating because it is the one that sees a woman from 16 and up until the end of her life.
Yeah.
So I'm looking forward to this segment. Now, in terms of location, I know we talked about Hoboken in one of our segments, but they're really everywhere.
Yeah, I mean, specifically even in Exchange Place, for example, you know, we have family practice there. I have Dr. Ali with me that does a lot of pap smears and so on and so forth, and a lot of the preventive women care. So again, and that's a big focus, especially preventive women care. Even from internal medicine primary care, you know, because most of the devastating diseases like diabetes and hypertension and renal failure, it's unfortunate, statistically, the women are the ones that end up with a lot of the wrong end of the statistics, so to speak. So this is why it's very exciting to be able to offer a lot of these services actually in our community, you know, and helping our patients to become family with our WJ Barnabas Health.
Well, I do have to add, in addition to this really good preventative baseline, we're experts in high-risk OBGYN, so high-risk pregnancies, maternal fetal medicine, really complex high-end medicine to the medical center through our Grove Street Clinic. And those are some of the things we're looking forward to talking to Dr. Bruck about. So all types of healthcare, so whether you have sort of a regular pregnancy or what is classified as high risk for multiple reasons, we're able to handle that. And I think there are not many institutions that have all that under one umbrella.
I mean, I've been in practice in Hudson County for 26 years, and I can't tell you the number of patients that I have, you know, that I've already having children, and not only am I seeing their children, but I'm seeing their grandchildren are part of the RWJ Barnabas Health and so on and so forth. So it's just beautiful to see that, you know, you're taking care of a patient, and then, you know, the patient has a baby, you know, delivered by RWJ obstetrics, and then follows primary care with our WJ Barnabas Health. It's very exciting. It's actually very neat.
Absolutely, and it goes back to our philosophy, right? And you and I have talked about taking care of the entire patient
Correct.
through their lifespan.
Correct.
And really,
Generations.
Yeah. I'm not going to say generations for me, but
I have a few. So it's very exciting work that we're actually doing in Hudson County. And again, we're interested in hearing from the community to find out what other services are needed. What else? Where else can we fill in the gap for the preventive medicine, and especially even in women's health? You know, because we're all ears. You know, we're here to serve the community.
And we're also excited to know how our women's health physicians integrate women who may not be, as you say, as affiliated with primary care or cardiology or any of those services. As we know, just because women come to women's health services at different ages now, there is an increasing need for those services, and we'd like to know how they integrate them. So it's going to be an interesting segment.
No, and like you said, it is sometimes the first introduction for patients into the healthcare system. So I've gotten plenty of referrals myself for things that the OBGYN has seen and so on and so forth. So it's a whole integrated network. And now we have probably the best EMR in the United States to help facilitate that integration. So we're going to go ahead and take a break now, so we'll be right back.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one path stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a part of RWJ Barnabas Health. I am here today with my co-host.
Yeah. Hi, I'm Dr. Angel Lazo, internal medicine in Jersey City Medical Center at Exchange Place.
And it is our pleasure to welcome Dr. Lance Bruck, who is Chairman of Obstetrics and Gynecology at Jersey City Medical Center, as well as Clinical Professor at Rutgers University, New Jersey Medical School. Welcome. Please tell us more about yourself. Good to see you.
Well, thank you. Thanks for having me. It's great to be here. So you already introduced me, but I've been in academic medicine for 31 years. And this is my 6th year now at Robert Wood Johnson Barnabas Health and practicing at Jersey City Medical Center.
Perfect. Tell us more about your practice.
Sure. I trained as an obstetrician gynecologist and big advocate for women's health. My clinical practice is related to pre-invasive and invasive cancer of the gynecologic tract, and I see and treat patients who have gynecologic malignancies.
Excellent. Now, can you tell us a little bit and expand, because this segment is really about preventive women's health. So tell us a little bit about some of the services that are offered, not just in your private practice, but obviously at your Jersey City Medical Center.
Sure, would be delighted to share. So we're interesting, being part of the big health system. We have one of the largest, if not the largest, group of women's health providers, certainly in Hudson County, but maybe actually in the whole state of New Jersey. We have providers that cover all of the subspecialties of OBGYN. So you have general OBGYNs who do a lot of the preventive care. We have high-risk obstetricians who take care of high-risk pregnancies. We have infertility doctors. We have gynecologic oncologists. We have urogynecology, and happy to announce that we're actually going to be adding breast surgeons to our women's health practice to be able to treat women from head to toe. So we really cover the full gamut of all services that a woman would need during her lifetime, and really are in a unique position to be able to do that in an academic setting, and really providing the highest level of care at a multitude of facilities throughout Hudson County.
So a very big theme of the show for both of us, Angel and I, is preventative health. And I just wanted to hear from you, what are the most common health issues affecting women, and what preventative services do you offer as part of your enterprise?
So we encourage young women to start to see a gynecologist. I mean that obviously is an individual decision that each young woman's going to make, and may actually be making that in collaboration with their parents. But certainly, there really is no lower limit to actually starting gynecologic care. Probably most women have their first visit, sort of towards the tail end of high school, or before they go off to college. And I think that's probably around the right time to establish care, to establish a relationship. And really, it's about talking about sexual health and getting educated. So, in terms of prevention, a big part of it is about being educated early on about sexual health, and that will carry through, throughout a young woman's life and into adulthood. It's something I think that, nationally we don't do a really good job about, and I think it's part of the reason why we have some of the systemic issues that we have related to women and their health care. There's this stigma about talking about sexuality, and it, we encourage young women to start that care early. There's been a lot of changes in terms of screening guidelines that have happened over the last decade, and not to get into the political muck of it, but there are different national agencies that have differences in opinions. But typically within the women's health, our professional organization, which is called the American College of OBGYN, sort of sets guidelines and really has shown evidence and why these guidelines make sense. But one of my philosophies is really to treat each patient individually. So I always try to teach my learners or my medical students and residents, right? There are guidelines, but you really have to cater the care to each individual patient and make it very specific. So, in terms of guidelines, obviously cervical cancer screening, which is really important. It's sad that in 2024 that we're still seeing cervical cancer in the United States and in New Jersey. Unfortunately, I would report that in Hudson County, the rate actually is actually pretty high, and we have work to do there. Obviously, breast cancer screening is really important. Colon screening is important, and then certainly as women get older, making sure when women get into risk of endometrial cancer, that they understand what the warning signs are and are seeking care at the right time.
Well, we really appreciate you sharing this with us, and we really thank you for coming and sharing what's going on in Jersey City Medical Center with preventive health. Thank you very much, and we'll be right back.
I've got cancer.
We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a member of RWJ Barnabas Health. It is my pleasure to be here with my co-hosts, Dr. Angel Lazo, and Chair of Obstetrics and Gynecology, Dr. Lance Bruck. Welcome back.
Thank you.
So we ended the last segment, Dr. Bruck, with you talking about just some prevalence of things like cervical cancer and breast cancer here, sadly, here in Hudson County. So you've recounted sort of all the services we have, and something we're all passionate about, really we've committed our life to bridging the health equity gap. How can you encourage women out there, some of them who may be watching this, to going for screenings, or where they should get screenings, and what do you think are some of the barriers that you can help our viewers break down?
Yeah, well, I think we identified some of the barriers, and anyone who lives in Hudson County, particularly in Jersey City, recognizes that people don't like to leave their little community or their little hamlet within the city. So one of the approaches that we've taken is to bring our services to individual communities. So when we originally started out in 2018, we had a central office in Jersey City, but now we have a hub right in Grove Street, and we've tried to place all of our facilities close to public transportation. So our Grove office is right next to the path, and we just opened up recently an office in Hoboken, downtown, also with easy access to public transportation. We opened up a hub in Bayonne, in the center of Bayonne, so people in that community actually could walk, even though it's one of the few places in Hudson County that has actually a parking garage with ample parking. And we're looking to continue to do that. We have a hub in Jersey City in the Heights, and we're looking for other strategic locations to put our facilities directly into the neighborhood so people have access. So I think one of the questions about why patients aren't able to get the care is really access. So we're trying to bring the access directly to the community.
No, and it's not just the access. I think it's actually the abundance of services that you actually offer. So it's not just, obstetrics, but it's also a lot of gynecological, and especially I, as internal medicine, am interested in urogyn, because I have a lot of patients, with urinary incontinence and so on and so forth. And again, not that urology can't handle it, but for my female patient, honestly, it's a little bit better, actually, in my opinion, if they see a urogyn, which again, you actually have. So elaborate a little bit about some of those specialty things, the urogyn, the infertility, et cetera.
Yeah, so I agree with you. I think having specialists who focus on women's health, I think, provides an ease to patients, because there's a familiarity and understanding how to speak to women about issues that a lot of women are resistant or hesitant to speak about. So we've embraced that. I think the way we've set up all of our offices and really being new facilities that are very welcoming. And I'm fortunate to lead a group of physicians and providers who understand what our role is in order to engage with patients and allow patients to truly open up and bring their issues forward. You can't fix something if you don't know about it. And certainly a lot of patients from embarrassment, particularly around urological issues, are embarrassed to talk about it. So having that comfort level from the space to the providers, I think opens the door to, one, talking about it, and then being able to diagnose and then treat people.
Excellent.
So it's intriguing that, we're talking about things that people are embarrassed to talk about and stigma. So speaking as a woman, even though I'm a physician, I've practiced for many years, I know many women just don't know which doctor they're supposed to talk about sexual health with. Like, is it our primary care doctor? Is it the OBGYN? That's the person that does the pap smears. Who is that doctor? And I know you alluded to it at the beginning of this chapter of our segment. So just talk more about those services and how women of all ages really can feel like this is their one-stop shop to be open and have those conversations and those concerns.
Yeah, I mean, in principle, I think that all patients, women, men, right, being able to open up is being comfortable with your physician, no matter what specialty that it is. I do think, as I mentioned earlier, for a lot of women, talking about sexuality, talking about urinary incontinence, talking about other things that may cause embarrassment, really it is about finding the right physician, making that connection, having the time to have a conversation in detail, and providers, and I think as women health providers, particularly those that are doing a lot of general care and preventive care, is knowing that it can't be a 5-minute visit, right? Many of us now see these visits that last 5 minutes, and and sometimes you don't even see the physician. You see a mid-level provider. Not that mid-level providers aren't part of the healthcare team, but we have our new appointments set up for 30 minutes where you're actually sitting with the physician, and that gives you an ample time to make that connection, feel that you can open up and be somewhat vulnerable. It starts with the conversation, and then it leads to hopefully the right diagnosis and ultimately management for each individual patient.
We're going to be wrapping up this segment just shortly in the next few, in 20 seconds or so. But I wanted you to elaborate a little bit because, again, you're an academic physician, what the academic aspect means for the patient. Because a lot of patients, when they go to training hospitals, they see themselves as, well, you're being in training. Elaborate what that means to the patient as far as having a resident or being in academia as a doctor.
So, I've been doing academics, as I said, my whole career. It's something that I think brings a much higher level of care to patients. And the concept that you're being treated by a trainee, well, trainees are involved in your care, but certainly at our healthcare system, all trainees are supervised at all times. On our service, you will never be treated, solely by someone who's in a learning environment, whether it's a student or a resident. Our faculty are intimately involved in all of the care, but it brings a higher standard of care, and in many ways, learners keep the entire healthcare system at a higher level because the more people that are asking questions, to me, elevates the care that is provided globally.
Well, thank you very much, and thank you for coming and sharing that with us. And we thank you once again for joining us at Hudson Health.
We'll be back after the break.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Well, welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a part of RWJ Barnabas Health.
And I'm Dr. Angel Lazo, Internal Medicine at Exchange Place with RWJ Barnabas Health. So in our last segment, we spoke to our specialist.
That was fascinating.
Fascinating. I mean, what I really like is the diverse amount of services that are actually offered by them. And again, it includes fertility, which is a big deal. I mean, most women are actually having childbirth a little bit later in life. There's a lot of issues, with genetics and so on and so forth. So to be able to offer that comprehensive service is incredible.
Yeah, I really liked the fact that they offer services from a woman's teenager to the end of life. And really those services for which, you could have some stigma around, like infertility. A lot of women don't talk about it, even though it's a very common problem. Sexual health, all that. And that we're able to take care of that comprehensive segment of our society. Yeah. So I thought that was very intriguing how he talked about that.
And especially when it's in a multidiscipline group type setting, because again, it includes all the gynecological services, but then you have every other service that could basically support that family or that patient. I particularly really like the fact that, for example, they do a lot of urogynecological procedures and or diseases. And that's a big deal in my practice. A lot of my women have a difficult time actually seeing urologists, for example. It's a little bit different. So there's very few gynecologists that actually do urogynecology. So it's very interesting to see that they provide the full gamut.
They do, and there's an intentional effort at access. So with all the locations, so a woman doesn't have to travel far and have a comprehensive set of caring doctors that spend time in our location. I thought that was really great and a blueprint for how it should be done.
And again, with RWJ Barnabas Health in Jersey City, we have the Rutgers affiliation, and especially with the cancer with the NCI Institute. And and again, talk about the services, including gynecological oncology. So it's a huge deal for this community, very huge.
Correct. And a little sad to hear the prevalence of disease in our community, but that's where prevention comes in. Yep. I thought Dr. Bruck did a really good job of talking of all the preventative services and how women can access them across different ages. So we don't get to the part where women are diagnosed with sort of more terminal illnesses.
And we're hoping that someone saw this today and basically, some woman says, let me start my health. I'm only 16, I'm only 17. You're never young enough to really start your health adventure. So we'll be very, very fortunate and very lucky at RWJ Barnabas Health to be able to facilitate that for our community.
Absolutely. And schedule your annual pap smear, note to self, get your mammogram. Yep.
Absolutely.
Make it a girl's day. It's not the most fun thing, but you have to do it.
But we're very fortunate to have that actually here in this community, because it's very well needed and very well served. So.
Well, I know Dr. Bruck well. He's also sort of a consummate academic. You can tell, passionate about teaching residents and medical students and bringing that, up game to our society and to our system. I really
well, that's what the academic institution really brings. The academic institutions do bring the leading technology, the leading medical advances. We're very happy to actually share that in our community. So I want to thank you as my co-host. We're very lucky to have Dr. Bruck with us today, and we're going to have him back, for sure. So we thank you very much for joining us today, and as one of your co-hosts, want to say thank you for joining us, and we look forward to seeing you next week.
What an incredible opportunity to host this with you. Thank you very much, and thank you all for joining. Have a wonderful day.
We'll see you next time.